thank you all very, very much, and I am very, very honored to be on this stage and sandwiched between these really moving and speakers. The great news is that I am bringing you news about where the public is on prevention, and the public is way ahead of the elites. Of course, given where elites are, particularly elites in Washington, D.C., and I love the ones that you have sent from Chicago, but given where elites are, it doesn't take very much to have the public be way ahead of them. But the other thing that I want to share with you is that while there is definitely need for all of the public education and efforts that you all are engaged in, the public is very, very responsive to this area. They are strongly supportive of prevention. They believe it should be a higher priority for the country than it is. They are a little bit confused about the distinction between community prevention and individual prevention. And I think that's probably one of the most important lessons that I can leave you with, is that we have to bring that together in a better way. But when it's explained to them, particularly around children, people are very, very engaged in community prevention efforts. People believe that prevention is not a priority. You can fool the voters some of the time, but not all of the time, apparently. And they fully recognize that prevention is not the priority that it should be in our efforts, and that public health is not the efforts. They give the country bad grades, C and D. They support allocating resources, although they are tax sensitive. And of course, in this economy, in some ways, it's reasonable to be tax sensitive. If you've been in a recession for 3 years, if someone in your family's lost their job, if your wages have been stagnant for more than 3 years, if your kids are back home, and 54% of kids are back home with their parents, much to their chagrin and their parents' chagrin, then it's reasonable to be tax sensitive. And people are concerned about spending taxes in this area. But they're still very, very supportive of investing resources, and also looking for ways that communities can come together and take action. And women in particular are looking for twofers. Of course, we're the ones who save the grocery store receipts to buy computers and buy green. We're always looking for twofers and threefers. And this is an area where people are really looking for where can we get 2 for 1. If we look at the data then in terms of public health, and you all can get all of these slides, so don't worry about taking notes or anything. First of all, in terms of how America grades our health, particularly around wellness and prevention, and there used to be a time when wellness didn't test very well. It's actually improved. People have always loved prevention. In part, people think prevention's fun. You know, it's going to be good to do prevention. Wellness sounded like, maybe you have to cut back on those potato chips. That doesn't sound as fun. But now prevention and wellness are testing about similarly. But you can see the vast majority of Americans saying that our country gets a C or D on this at best. The priority that people would put on prevention, 86% would make it a top priority for prevention or wellness. But only a third of the voters, less than a third, believe that it is a priority today. People overwhelmingly believe that community prevention is important as well. But again, people very unclear about what community prevention really is. And one of the most important things is to give people examples of community prevention. And I'll show you some of the more popular examples. But 81% believing that it should be a priority, only quarter thinking it is today. When we ask people, do you support or oppose investing more money and resources in community prevention efforts to make it easier for people to maintain their health and make healthier choices? First, when we didn't mention taxes, 73% in favor of it, 43% strongly. And these are good numbers, particularly for a concept that's still a little bit vague to people, because people still think about prevention as very much an individual level activity. Notice the intensity. By 2 to 1, the intensity is on our side. When we asked about funding, again, under 50%, but still by 16 points, people supported funding for community efforts rather than saying, hey, times are tough, we absolutely can't afford this. People do think there ought to be things that we can smartly spend money on that provide some of these opportunities. A real base of support, and it's not surprising, I think, who the leadership is. It isn't only just the medical opportunities program, which is just such a terrific statement, frankly, and thank you for all your leadership. But also the African American and Latino community, extremely oriented toward community prevention, and think this is money well spent. These communities get that you're spending money today to save money in the future, and have a very, very strong understanding, very, very strong support of that. Women also more supportive than men, but men still support it by 10 points. Now, this is interesting, right? Because men are supposed to be so anti-big government right now, and anti-government, and the supporters of the Tea Party, and the supporters of Paul Ryan. But as you can see, when you talk about community prevention, when you're talking about national commitment but local involvement, excuse me, you start to get the men on board as well. We then tested a number of policy proposals. People are overwhelmingly in favor of policy proposals that involve children. Healthy schools, healthy kids programs, and I'll show you the wording in a moment. 2 for 1 also tested very well. And again, I'm really appealing to moms and mothers and women. Healthy schools, healthy kids, talking about PE, talking about more nutritious lunch. You'll remember we're on the anniversary, actually. I think it's like, well, what would it be? It'd be the 30th anniversary of ketchup being declared a vegetable. One of the all-time peaks for our movement, I think. And you'll remember, actually, God bless him, it was a Republican Senator, John Hines, who had a certain amount of attachment to ketchup, who said, I want to make it clear, ketchup is not a vegetable, despite my family's long attachment to ketchup. Also, we tested physical education 3 days a week, physical education every day, both very, very, very popular with people. Then 2 for 1. In these tough times, we have to do more with less and find ways to promote prevention while we're doing other things. When possible, every school should have a community garden. We should use our schools facilities after work for exercise program. When we repair parks and streets, let's build playgrounds and bike paths, which makes sense. For minimal cost and effort, we can get multiple benefits. People overwhelmingly love this initiative, and women in particular. People also like building it into science classes. And you know who liked best building it into science classes? African Americans and Latinos, who thought this is a science you can use. This is a very important piece of that. Other things, better food policies, very popular with people, and also changing food incentives. And this whole thing about food deserts and getting produce into our food pantries and our grocery stores, extremely, extremely popular with people. And people in urban communities, and particularly in lower income neighborhoods, aware that they got more liquor stores than they have grocery stores, and upset about that, and wanting to see that change. Finally, okay, this is nice that people like this, but would they ever vote it? Well, in fact, 66% of the voters say, yes, I would be more likely to vote for someone who came out for these programs. We also tested targeting programs, and really people like programs across the board right now. They do not like targeting in general. And we just finished a whole bunch of work on English language learning, and people liked it much better when bilingual education was expressed as any child could go into it. And we said to people, well, wait a minute, your child already speaks English. What does your child need bilingual education for? They go, well, they don't speak very good English, so maybe it would be good to get them in there too. Sometimes it sounds like a whole other language. So in general, people like broader programs, but people do like it when it's targeted to certain neighborhoods, although they don't like as well expressing income or racial targeting. The one exception to that, African American voters, and they do like it better when it's expressed as income and race. And finally, our best messages. Our best messages work that really anchor, and if I was going to leave you with one thought, it's making good, healthy choices easier for people. And that really resonates because it still has the individual piece to it. People love the word choice, and we're using choice now as part of community as well as individual. People think everything is getting harder now. And so the idea of making something easier is very, very popular with people. But here are the best messages overwhelmingly. And you get 3/4 of the voters saying this is convincing, 40% saying very convincing. Those are good messages. Anything to do with children. People believe, contrary to some of our elected officials, people believe that you can't tell kids to wait 5 years until we get our act together. They kind of march on relentlessly, and you're about to hear from a governor who always had that dialogue with her voters and was really a national leader on that. Michelle Obama, we tested her language without her name in it because we didn't want to have the polarizing effect of Obama, although Michelle is very popular. Her language tested off the charts. Individual responsibility, and then also giving examples. There are many people out there who think, this sounds like a good idea, but has anybody done it? I don't know how we can get it done. And giving examples of other cities that have been successful, very successful. So here you see the language. Kids are our future. We need a healthy future. It's important, Michelle, it's important to get preventive care. And in fact, her obesity effort is really, really popular when it's expanded to other broader prevention efforts. And then individual responsibility, yes, there's a role for individuals, but we ought, as a community, make these individual choices easier and giving examples of what other cities have done. So the great news is, it is your time. It may seem in many ways like it is the toughest of times, but actually there is really an emerging public consensus here that needs to be nurtured, needs to be educated, and needs to be tapped into. And the biggest thing that I would say is we need to define what community prevention is for people. We need to start this locally at the grassroots. It will be something that will trickle up rather than trickle down. We need to include individual responsibility with community responsibility, but talk about making healthier choices easier for families. And then we really need to tap in here to women in particular, to the moms and all of the women in our society. Talk to them about how we can do things better for kids. Talk about how we can get 2 for 1 here if we're smart. And talk about how we can combine, how it's been successful in other cities, and we can combine individual responsibility with community prevention. So thank you for all you do. I hope that's helpful in your efforts. And are we taking questions now or later? So I can take a couple of questions now. So questions from people or comments or examples? Question? We definitely want Lois to be heard because she has been doing some of the greatest work in this, particularly geared towards women's health care. It's so good to see you.
Thanks so much, Celinda. I'm delighted to hear this presentation. Not surprised to hear that women are really strongly in favor of prevention. I wonder if you could say a little word about how we all could use the opportunity this year to make contraception a preventive service under the Health Reform Act. And
yeah. I think this is an enormous opportunity, and we're hopefully going to get the opportunity to work with Lois and many of you on this effort. I think this is a huge, huge opportunity. First of all, people believe overwhelmingly that contraception is a core basic health care piece. They're wildly supportive of it, and of course, you may have seen, the Washington Post did a great poll where they heard that, where they asked people, what's the number one word you would describe the efforts to shut down the government over funding for family planning for Planned Parenthood, and people said, my number one word is ridiculous. Planned Parenthood also 65% favorable. Over 3/4 of Americans believe that contraception should be made accessible and affordable for all Americans. But what is coming up is this opportunity to have it included as a basic preventive care and therefore included in policies and covered, mandated coverage by insurance. And our belief is, and we're hopefully going to get to do some polling on this, that this is a threefer really. First of all, very popular policy, but also a great opportunity to get people's costs down. One of the problems we have in ACA is it's perceived overwhelmingly by voters to increase people's costs. This is going to be a very good opportunity to actually decrease people's costs. And then women are infinitely relieved to hear that being a woman is not a pre-existing condition. And so this is another opportunity to drive that message home. So Lois, thank you so much for your question, and I hope we get to work with all of you on this and can share this information with you. Other questions or comments?
Hi, Pat Sloan. I would like to encourage with that contraception that we include HIV prevention so that
Yeah.
we look at all aspects of contraception.
Very, very good point. And you know, one of the things that is so interesting about HIV prevention, and you know it, but it's interesting that the public is increasingly becoming aware of it. It used to be around people are very, very supportive of HIV prevention, but there used to be an age factor in terms of how relevant this is, et cetera. And now we started to see an uptick in terms of interest in healthy sex and healthy sexual lifestyles in older people. Thank you, Viagra. We're actually seeing an uptick in support of HIV and STDs, et cetera, because of changing, and we won't get into the graphic details there, but changing lifestyles among older Americans.
Hi, thank you for your presentation. I'm Matthew Marson with Public Health Institute. I wondered if I saw the general comments about taxation and the impact that had on responses, but did you go deeper on the question of soda tax or sweetened beverage tax and the response to that?
Yeah, we did, and we can, the data, and you can have this whole presentation. The data is here. Let me see if I can find it, or actually I'll just tell you what it was. I'm not sure I can find it fast enough for you. It's really interesting because people have very mixed views about taxing junk food and taxing sodas. And they start out weaker on it than other forms of taxation. And then, as many of us know who have been involved in these soda tax campaigns, you know, once you try to put this initiative on the ballot, it takes almost nothing to be defeated by it. And the bottlers come in, and the soda industry comes in, and we can't hold our support. And it's just inconceivable. I mean, God knows why Americans will not tax soda. Actually, the numbers have gotten somewhat worse, too. And we thought they were going to get better. In this recession, we're so short of revenue. Okay, let's go after Coke, even if it is the dream. People said, no, are you kidding? That's the only luxury I can afford anymore, is junk food and soda. So it's very tough, honestly. And it starts out in favor of, people start out in favor of it, but weakly in favor, and then it's very, very hard to maintain that support. Now, having said that, there are other aspects of the campaign that are quite popular, like getting soda and junk food out of schools. Very, very popular with the voters. Sometimes I think if we put the taxation into a specific fund, we can increase and maybe hold the support longer. But it's tough. The soda tax in particular is tough.
Hi, Debbie Walker from APHA Associates. Thank you for that great presentation and what you've known. I want to ask you a question. Thank you. You didn't use the word public health. It was important to understand the community piece, which is key, even though that's so linked to what we do or facilitate. And there's so much else we do in public health for the whole system. So your advice and what you've learned on that.
Yeah, really good question. And I think this is an area, of course, a pollster would say this, right? I think this is an area that we need more research in, preferably with Lake research. But here's what we know. Public health is very popular with public. But public health also has a downscale connotation to it, which prevention does not have. And you saw how people were nervous about the targeting. And people thought, you know, for example, you know, and it's so frustrating, we could just scream, right? People were supportive of the public plan, but they didn't want to be in the public plan. They assumed the public plan would have lower quality. Similarly, public hospitals, and the public hospitals are meeting here as you speak, so you guys get together for that taste of Chicago. You know, people really support their public hospitals. They don't want to go to their public hospitals. So public health has a little bit of a downscale connotation to it. I think, however, this prevention is, and it's implicit in your question, is this wonderful opportunity for a synergy here, because prevention does not have a downscale connotation. If anything, prevention has a little bit of an upscale connotation to it. That people think, well, prevention's all fine and good, but who can afford that more expensive food or whatever it is? Who can afford that extra tax? And, you know, America, it's reasonable to be concerned about that because, you know, 4 months ago, we had the single biggest increase in food prices due to oil and gas prices that we had had in 32 years. And the biggest jump, 50% increase in the price of organic vegetables. So it's reasonable for people to be worried. So I think there's this really interesting marriage of prevention and public health. So know that you're wildly popular it's kind of like environmentalists. We asked the question, would you like to go to dinner with environmentalists? And people said, well, it would be very interesting. They would talk a lot. I would learn a lot. I'd only want to do it once, though, because it would be exhausting. So you're kind of like that. People love you, but don't necessarily want to be with you all the time.
This actually is kind of related to where you're going to. A lot of your framing was around, I think, chronic diseases.
Yes.
How about you talk about infectious diseases and prevention, where now you have more issues of maybe protection,
Yeah.
and the issue of safety net and support for services for individuals that may not be covered under the ACA, and how is that? How does the public react to that, and is there any support in that?
Oh, very good question. First of all, people wildly in favor of the public health aspects that get to infectious diseases. That part is actually very easy to get support for. And when you were giving that litany of it will be inspected and all of that, the public wildly in favor of that. I can't believe we're cutting back on inspectors. They can't, the infectious diseases, if something goes through the community, or, you know, you're going to sort out whether the tsetse fly is here or in West Africa, because people don't have the best sense of geography and they're not sure how long it took the fly to fly over here. So, you know, and after all, there's a penguin in New Zealand now, so who knows? So people very, very strongly in favor. Infectious disease is actually easier than the other aspects of public health. Having said that, I think people assume it's covered in ACA, frankly, and would have no idea that it wasn't.
Thank you so much. I'm Sana Shahimi with Prevention Institute, and I'm really interested in a lot of the messaging around individual responsibility and making the healthy choice the easy choice, and we do a lot of media analysis at Prevention Institute.
Oh,
and
interesting.
one of my questions for you is, based on the research you've done, you know, what are some thoughts around how we expand people's understanding of that? While certainly there's an element of individual responsibility, we're making choices in a context where most of us actually don't have true choices. Like our options are actually being externally controlled, you know, whether it's what our kids are served at school, but also what is or isn't in our supermarkets, or what we have access to in our communities.
So there is a huge racial divide on this question. And Anglo, white people, Caucasians, they believe you have choices. They don't buy that analysis that many of us do not have choices. And of course, probably some of that is income related. Latinos and African Americans, independent of income, absolutely accept that analysis, that we don't always have the best choices, that we don't have control. What we found time and time again was that what is really powerful here is to not cede the choice and control terrain to the other side. So to engage that, to co-opt that, and to say, we got to make healthier choices available to people. That worked a lot better, to say we got to make healthier choices easier for people than to say they don't have healthier choices. Because when we said they don't have healthier choices, people just argue. Yes, we do. This is America. You have choices here. What are you talking about? When we said we got to make it easier, it's like, thank God, finally, someone gets it. So just entirely different kind of framing. I think, you know, there are some education efforts to go on in terms of what real healthy choices means. And I think it's easier it's what we call in our business the responsive chord. That if you try to tell people something, and I think you guys have it in your business too, right? You try to tell people something, they fight you. You let them conclude it. Like, yeah, we need healthier choices. Damn, how come we don't have these choices? Then they respond much stronger. So it seems like the best thing is bracketed by say, yes, there's individual responsibility here, but we got to make these choices easier. And then as people think about what are good choices, what are the kinds of choices we can have in their community, they'll conclude, hey, you know, we don't have enough of this. And women in particular will conclude, we're treating this as zero sum and it's not. Why can't we walk and chew gum at the same time? And so they really are like, we should be able to have it both ways.
Good afternoon, Jillian Jacobellis from the Colorado Department of Public Health and Environment. I was very pleased to see your data on overwhelming support for the 2-for-1, specifically utilization of schools.
Yeah.
But my question is the implementation phase. When we in Colorado try to address this and have initiatives such as that, we have a litany of unfunded mandate,
Right.
and as well as liability. What are the system changes that you would support to help address those issues?
You know, I should let that be answered by someone else because I am not a policy expert. I don't pretend to be one. But it's a very good question that you raise. And frankly, it's the same kind of problem that we have with the after-school programs. That this sounds very logical to the public. They have no idea why we can't implement this. So maybe one of the, I think my time is up as it is anyway, but maybe one of the future speakers can address that, and it's a very, very important, good question. Thank you so much.